I'm reminded in doing these office hours of a funny story. When I was a teenager, we lived in the Bahamas for a few years. I finished up high school there. And my father's an orthopedic surgeon, and he was the consultant orthopedic surgeon at the main hospital there, the Princess Margaret Hospital. And he did a radio show one time, like it was a health radio thing in the Bahamas, a call-in show. And at the beginning of the show, he specifically said, this show is about, I don't know, it was osteoarthritis or something, some orthopedic thing. And please limit your questions to osteoarthritis. And as soon as they opened up the lines, the first person who called in said, Doc, one of my testicles hangs a lot lower than the other one. Is that a problem? I remember listening to it on the radio. I was in high school. There was this long pause, and my dad just basically ignored the question. So I think that would be a good preamble to say that we are going to try and limit the Q&A to the vaginal microbiome, but I love all things gut, and I can't resist a good poo question. So we might have to give a little leeway there. Okay, I'm going to go ahead and get started. Welcome everyone to today's office hours, where we're going to be talking about the vaginal microbiome and the risk of sexually transmitted diseases. And I just want to say again, I know you know this, that thank you. I'm glad you like that story. That I am not your doctor. I wish I were, but this is for educational purposes only. Okay. So first thing I want to tell you is that the vaginal microbiome and really the reproductive organs are our next door neighbors, right? I like to consider myself a below the belt doc, although of course the stomach, the esophagus, etc., are above the belt. But when we think about the digestive tract, we're generally thinking about stuff that goes on in the abdomen. And right on the other side are the reproductive organs. So we are really next door neighbors. Now, the main thing that I want you to think about as we chat about this is the idea that when it comes to illness, and specifically viral illness, but this is true for bacterial illnesses too, it's less about the potency of the pathogen and more about the health of the host. And you're going to hear me coming back to this idea time and time again. And it really is a central thesis behind my new book, The Antiviral Gut, which is coming out in the fall. And later this summer, I'll start doing some more sessions specifically on antiviral tactics, because this stuff is incredible when you really think about the antiviral, innate antiviral, and really anti-illness defense mechanisms that we have baked into us and primarily in our gut. The main thing is, like, let's not dismantle these. Let's support these and nurture them and not inadvertently dismantle them so that we can keep ourselves safe. So when we think about the vaginal microbiome, one of the first things I want you to do is forget everything that I've ever told you about diversity being good. Because when it comes to the gut, diversity, having a wide array of different microbes, is essential. But when it comes to the vaginal microbiome, monoculture, one species reigns supreme, and that is lactobacillus. And as I continue on with this, you're going to understand why that's so important to have a lot of lactobacillus. So lactobacillus has several different subtypes. It has Presperi, Inners, Gensi. And as I like to say, if they sound like Roman gladiators, that's because they are. So the bacteria, lactobacillus bacteria, have a really sort of lethal talent, if you will, and that is the ability to produce acid, which is why in a healthy vagina, the acidic sort of milieu is typically less than 4.5, right? It's supposed to be acidic. And when we think about abnormal conditions in the vagina, like bacterial vaginosis that I'm going to talk about, one of the ways that we diagnose that is by looking at the pH. And when we check the pH and we see an alkaline pH above 4.5, we know that the lactobacillus species are reduced. So what do lactobacillus do? They produce lots of acid. How is that helpful? Well, just like in the GI tract with the stomach acid inactivates viral proteins like SARS-CoV-2, for example. It denatures the viral protein, so it essentially inactivates a virus and prevents it from infecting us and replicating. Well, the same thing happens vaginally. The high amounts of acid produced by lactobacillus repel invaders like HIV, human immunodeficiency virus, HSV, herpes simplex virus, HPV, human papillomavirus, and several others. And so I'm so sorry, I don't usually check my phone, but okay, something that can be ignored. Yeah, so the acid produced by the lactobacillus repels these different viruses, inactivates them, denatures a viral protein, inactivates them permanently so that they cannot infect us. So let me just tell you a little story to sort of set the stage. I have a patient of mine, not her real name, but true story. Name is Marissa, not her real name. And Marissa was a longstanding patient of mine. I took care of a lot of her family. In fact, I diagnosed her with Crohn's disease when she was 16. She went off to college a few years later, met a boy, had sex for the first time, came back from school. I think it was spring break when she came back. It might've been the summer, with a case of genital warts. And I had been her doctor since she was a young teen, and she didn't have a family practice doctor. So her parents called me quite upset about why she had developed genital warts, HPV. And as you probably know, with human papillomavirus, there are over 100 different subtypes, but certain subtypes tend to be associated with different manifestations. So subtypes 6 and 11 are often associated with genital warts, and subtypes 16 and 18 with cervical cancer. So this is Marissa's first time ever having sex, and she gets genital warts. And her parents are like, okay, she has friends who are having unprotected sex every day and only getting chafing. Why does she, why did this happen to her? So I think it's helpful to do a little excavating in Marissa's history so we can see what are the different things that made her more susceptible to coming down with genital warts her first time ever having sex. And let me point out that 3/4 of the sexually active population in America will be exposed to HPV, and a huge percentage will have HPV, but it will be completely asymptomatic or very mild infection. But what is it about Marissa's case where when she got exposed to HIV, she got a quite severe case of genital warts? And this is where I want to again point out that viral exposure is to some extent inevitable, right? We are literally all exposed to multiple viruses all the time. But what is not inevitable is illness, chronicity, disease, debilitation. So if we excavate a little in Marissa's history, she had Crohn's disease diagnosed at 16. Despite our best efforts, mine, Marissa's, and her family, we were not able to get her Crohn's disease under control without using some immunosuppressive agent. So she was on, not steroids, but she was on a biologic, and biologics change the immune system. They don't suppress it specifically the way steroids do, but they do lead to some significant changes in the immune system. And those changes can be associated with a decrease in immune surveillance, which means that your immune system ability to detect cancer and to detect infection, particularly viral fungal infections, is diminished. And so that was a big hit for her in terms of, as we look at historically, why did this happen, is the fact that she was on a drug, and the drug that she happened to be on is Humira, that significantly changed her body's ability to deal with infection, number one. Number two, she had been on a lot of antibiotics for acne as a young teen. She'd been on doxycycline, I believe it was, for about 1.5 years. And while it did help clear up her skin, obviously it made a huge impact on her microbiome. Her microbiome took a huge hit, because you all know the statistic, right? About 5 to 10 days of a broad spectrum antibiotic can remove up to 1/3 of your gut bacteria. And so in Marissa's case, she was taking this doxycycline for well over 1 year, and that was clearly affecting her gut microbiome. When I met her, and right before she was diagnosed, she also wasn't eating the best diet. She was, as I said, around 16 when I diagnosed her, and she was eating what a lot of 16-year-olds eat, and eating from CVS and Starbucks, which are not places that sell actual food. They sell a lot of edible food-like substances. Actually, things have gotten a little better since then. CVS, I would still say, doesn't sell actual food, but Starbucks has some things that bear a closer resemblance to food these days. But she was eating a lot of food that was highly processed. It had things like emulsifiers in it. And what we know about emulsifiers in food is that not only are they associated with the development of Crohn's disease, but they erode the mucus layer. And this is where the vagina and the gut are so similar. So they're both organs that are open to the outside. They are hollow. They have a physical barrier, an epithelial barrier, and they have a mucus layer to protect them. And when you eat a lot of foods that have things like emulsifiers in them and other chemical substances, those things can literally erode the mucus layer and make that physical barrier that's just one cell thick more vulnerable for viruses and pathological organisms to invade. So there was her diet. And then there was the other thing is she was douching. She was douching pretty regularly because the antibiotics had really changed her gut flora and her vaginal flora. And she had developed something unbeknownst to her called bacterial vaginosis, which we're going to be talking about. And with bacterial vaginosis, what we see is a significant drop in the amount of lactobacillus. So in a healthy vaginal microbiome, typically the lactobacillus species are about 90% or more. Now there is some ethnic cultural variation to this based on diet, et cetera. We know that a lot of these studies were based on what's going on in the vaginal microbiome of white American women. We know, for example, that Black women in parts of sub-Saharan Africa have slightly different compositions. So I will say that, like everything else, there is variation. But notwithstanding that, we still know that a healthy vaginal microbiome is overwhelmingly lactobacillus. It may not be 90% or more, but it is still way more than 50% lactobacillus. And we can say that with quite a good degree of certainty. And so what happens with a lot of antibiotics is a lactobacillus drops because they are susceptible to antibiotics. And then we start to see a host of other polymicrobials, which are usually in the vagina, but just at low levels, start to increase. So that would be things like Gardnerella, Prevotella, Mycobacterium. So those things all increase. And of course, the yeast population can increase too, but that's another problem called yeast overgrowth. But with bacterial vaginosis, we go from sort of monoculture, lots of lactobacillus, to polyculture, lots of Prevotella, Gardnerella, et cetera. And with that, of course, the acid decreases because lactobacillus is the main one that can produce acid. These other organisms can't. And so because the amount of acid in the vagina decreases, the pH increases. And that's why that's one of the main ways that we diagnose bacterial vaginosis is by checking the pH. You can also do, the old way was this thing called the Nugent score, N-U-G-E-N-T, where they did a smear and they looked for, gram-negative rods, which are consistent with the lactobacillus versus other organisms. But now they typically will look for that thin whitish discharge, the odor, and also the pH. So because of this change in what's going on with the different microbes that are represented, she had a discharge, she had this fishy odor, she didn't know what it was, so she was buying these douches off the shelf at CVS and douching regularly. And of course, what that does is it disrupts the vaginal microflora even more. And now you're introducing these chemicals into the vaginal environment. And as luck would have it, some of the most important organisms, like the lactobacillus, are often the most fragile. And so those were getting reduced even more. So she was taking a biologic that changed her immune system. She had been on lots of antibiotics for a prolonged period of time. Diet wasn't the best. She was douching. What about the fact that she got the HPV her first time having sex? Does that play a role? It actually does, because your first time having sex, when the hymen is breaking, there's often micro tears. It can be a little bit more traumatic physically, shall we say. And so there were some tears in the mucosa, and those tears, not tears from your eyes, but tears as in a rip in the vaginal mucosa. And so that allows viruses to get in and set up shop in some of those nooks and crannies in those rips in the vaginal mucosa. So that also played a role too, right, in terms of her likelihood of getting these genital warts. Now, there's some really fascinating statistics about bacterial vaginosis. And again, let me just redefine it, that bacterial vaginosis is vaginal flora where the lactobacillus numbers are reduced and the other organisms that are normally present in lower amounts are overrepresented. Okay, so it is a dysbiotic state, just like with dysbiosis in the gut, where you have a decrease in good bacteria and an increase in bad bacteria. Sort of a simplistic way to describe it, but accurate, same thing. So it is, BV is really dysbiosis in the vagina. And some of the statistics are, well, first of all, let me tell you that BV's friend group includes infertility, pelvic inflammatory disease, sexually transmitted disease, preterm labor, miscarriages, and a whole bunch of other things, urinary tract infections. And that's because a vaginal flora is so important for setting the tone for everything that's going on, not just with the reproductive organs, but the pelvis in general, right? And so that's why you have increased rates of urinary tract infections, as well as STDs, as well as problems with labor, miscarriage, etc. One of the main things that happens with BV is it makes you more susceptible to getting sexually transmitted disease and sexually transmitted infection. And we talked about why that is, because you have low levels of acid, but not only do you have less acid to denature viral protein, you also have these increased levels of the things I told you, the Gardnerella, the Prevotella, the not so desirable organisms. And not only do they not produce acid, they also produce enzymes that punch little holes in the mucosa of the vagina. So they're basically saying, viruses, come on in, let me make it easier for you, right? So they're not producing the viral repelling acid, and they're producing enzymes that punch holes. And so people who have BV have a much higher likelihood of having sexually transmitted infections. And that range varies dramatically. The accepted number is about a 60% increase, but some studies say it's threefold. And if we look at something like HIV, we know the number for HIV is about 60%, that after exposure, if you have BV, you have a 60% higher likelihood of developing HIV after exposure versus somebody without BV. But there was a study of young South African women, for example, that found that the likelihood of HIV with BV was 4 times increased, right? So there's a lot of variation, but we can all agree that it is an increased risk, not just of things like genital warts, but of, even more severe diseases like HIV. So again, we come back to this idea, the health of the host, right? I mean, your best protection against sexually transmitted infections is to not have unprotected sex. But the next best thing, or arguably right up there, is the idea of having a really healthy vaginal microbiome that can protect you with lots of Roman gladiators, Lactobacillus crespi, inners, Gensi, etc., that can shoot out acid and basically repel all these viruses. And having an intact mucus layer, all of these things are super important. Okay, so when we look back at Marissa now, we're able to say, okay, here are some reasons that this developed when we sort of excavate. And that's a thing about medicine that I love, is it's logical, right? I mean, occasionally something does just fall out of the sky into your lap, but usually you can follow the breadcrumbs backward to figure out what happened. And really, that's a point of these office hours, and really all the work I do is, I mean, yes, I want to give you information, but I want you to think about things differently, right? So I want to frame this information within this idea of the health of the host, that you can be a healthier host. You can be more resistant to HSV, HPV, HIV, all of these things, to SARS-CoV-2, to autoimmune diseases. And again, it doesn't mean that these things can never happen, but you can dramatically and significantly increase your resistance and decrease the likelihood of these things happening. So again, these are all really important things to pay attention to when we think about the vaginal microbiome. And, so often people want to know, well, what can I do? I have this, what can I do? And I always want to say, well, let's talk about what you shouldn't have done. And they're like, well, that's water under the bridge. I did it anyway. But it's important to go back and excavate and think about that, because there will probably be another opportunity to do things right and to think, okay, how am I going to do this? And so when I see, and again, full disclaimer here, I'm not an OBGYN, but I do treat a lot of women for GI problems, and a lot of them have GYN problems. And so we are often problem solving together their GI and their GYN problems. And I'll tell you, if you walk into an OBGYN's office with thin white discharge, fishy odor, they check the pH, they're like, yes, the pH is, 6.2 and it should be below 4.5. This all looks like BV. You are almost certainly going to walk out with an antibiotic or a prescription for one, either an oral antibiotic, metronidazole, or something called Metrogel, which is a topical. And while Metrogel will work very well because it will reduce the levels of the troublesome Gardnerella, Prevotella, Mobilincus, Mycobacteria, etc., it is also going to reduce the levels of the lactobacillus, right? I mean, they're even more fragile. And so initially, you're going to be like, this is great, fishy odor gone, discharge gone, my vagina feels like really healthy and fantastic. But then over time, the BV is likely going to recur. And so I see women who have been treated over and over and over again for BV. And this is where this idea of repopulation, not eradication, like not a scorched earth, like kill all the microbes, but let us repopulate, kind of like gardening, right? I mean, I have a terrible green thumb. I tend to kill everything, even though I'm not using Roundup or anything. I'm just not attentive, and I overwater and then I underwater. But if you think about gardening, you know, and weeds grow in empty spaces. So if you have a garden and you have a lot of weeds, you can, you know, use some crazy pesticide weed killer combination to get rid of your poison ivy, giant hogweed, whatever, but you are also going to disrupt the ecosystem of bugs and soil, et cetera, that's important for having a healthy garden. So really planting and reintroducing species is really the best way to keep the weeds at bay. And this is true for gut health, and this is true for vaginal health too. So my approach for women with BV is to recommend a lactobacillus suppository. And there are lots of different brands out there. In my practice, I've used one called FloraFem. I don't have any association with any product, but it's just one that patients told me about. I told other patients. I looked at the research, et cetera, and I've had very good clinical results with it. So FloraFem, FLORAFEMME, but really any sort of heavy duty lactobacillus suppository will work well. I've even had some of my inflammatory bowel disease patients take their probiotic the prescription probiotic I'm giving them, and open some of the capsules out, or use some of the powder, mix with a little water, make an emulsion, use a vaginal suppository, shoot it up there. That's worked also. And then of course, the dietary changes are really important too. So getting patients on, you know, good diet, lots of high fiber foods, lots of fermented foods, all of those things to help with the vaginal microbiome are really important. And then of course, you know, what are we going to avoid? The antibiotics, the emulsifiers in food, etc. Okay, so let's see, we are at 12:24. We have a couple questions, so let me take a little break. Can FloraFem suppositories or similar suppositories be used while taking an antibiotic to prevent yeast or other vaginal infections? Naomi, that is like filling the bathtub with the stopper out. You're filling the bathtub and the water is draining out. You're not going to really get a full bathtub of water, right? So taking an antibiotic for, you know, the number one thing, and I cannot say this enough, and I apologize if I sound like a stuck record, is you have to really reconsider the antibiotic, because it's not like you're taking the antibiotic and then you're taking FloraFem and you're going to end up even. That's impossible. You are going to do some microbial damage. And depending on your background, your history, how old you are, all the other things about you, the likelihood that you're going to end up, you know, at a good baseline is not necessarily high. And again, it depends. I don't know your medical history, et cetera, but there is no probiotic that you can take that is going to replace all of those bacteria that you've lost. So the best advice I would give you is you really have to make sure that antibiotic is 100% absolutely necessary, no other choice. Now, if that is the case, then yes, a FloraFem can help. Taking it during, you can take it during, but taking it after is more important, because when you're taking it during the antibiotic is likely having some activity against that also. Okay. All righty. What else do we have? I'm glad you like my story about my dad and the testicles. Borax suppositories, I do not recommend, because they can be very toxic to some of the fragile other species vaginally. So while I know you'll go on chats, you read on the internet about borax suppositories, in my experience clinically, they're too harsh to use for the vaginal microbiome. Okay, yeah, after is better. Yes. Okay, so let's keep going, and then I'll take some more questions. And I answered both of these. Okay. All right, so the other thing that I want to remind you about the vaginal microbiome that is different from the gut microbiome is the effect of food on the gut. You know, when you eat, the food is obviously going right into your digestive tract. That's not the case vaginally, so it can be a little bit harder to shift the vaginal microbiome with just food. And this is why I'll often recommend the FloraFem suppositories, etc. But the same thing that I mentioned about the douching, we have the same problem with people using harsh antibacterial soaps. So you have to really be careful, like how aggressively you're washing vaginally. Because if you're using a harsh antibacterial soap or anything with a lot of chemicals and you're really, scrubbing in there, rinsing, all of that, it's almost equivalent of a douching. And you can also do some damage there. I know that in little girls who are taking bubble baths, for example, and little boys too, but it's more common with little girls, they can often get urinary tract infections or like a sort of pediatric form of bacterial vaginosis because of the bubble bath and all the chemicals, and they're sitting in that for a long time and it's entering into their vagina and they can get urinary tract infections. So, be wary of the bubble baths, especially with kids. Be wary of the bath salts. Make sure you know what's in there. Any bath salts that are highly scented, you have to be careful with, because with scent comes chemical. Okay. And that can also disrupt that delicate balance of microbes vaginally. All right, what else do we have? A couple more questions. Okay, I think we did the boric acid suppository one. What about using hydrogen peroxide after sex to avoid bacterial vaginosis? Yeah, that's another one too. Remember, peroxide is antibacterial for all bacteria. Well, not for all, but things like peroxide, alcohol, antibiotics that are what we call bactericidal, meaning they kill bacteria, they're going to remove typically some of your lactobacillus also. So I put hydrogen peroxide in the boric acid, borax category also. What can be helpful after sex is urinating, and just a little bit of rinsing with water can be helpful there. What I don't recommend is prophylactic antibiotics. I mean, I can't tell you how many women I've seen with severe gut problems. And when I ask them about their antibiotic history, they're like, oh yeah, my OBGYN put me on, Bactrim, whatever, and said just to take this every time I have sex. It's like, yeah, you're giving your microbiome a big hit every time you do that. So, if that is something that's happening, if you are having BV and you feel like it's related to your sexual partner, that's definitely, I think, should trigger you going into your OBGYN, having them maybe culture, see what's going on, look at the population of lactobacillus, because that you may be somebody who using a lactobacillus type suppository on a regular basis, not just after sex or intermittently, might be helpful to help get that population of healthy lactobacillus up to a good level. Okay, Epsom salt bath helps balance the pH. Is that true? The pH, if you're not doing anything to disrupt it, it doesn't really need balancing. So it's more using things like antibacterial soaps, douching, etc., that will create a more alkaline pH, or anything that's going to remove the lactobacillus, like antibiotics. But in the absence of doing that, it really balances itself. It is designed to sort of exist at that baseline level of a more acidic pH. So if what you're asking me is if Epsom salts can help get it more to a lower pH, I have to say I'm not aware of any study that says that using Epsom salts can drop the vaginal pH. But I do think Epsom salts are a better choice for, something soothing, etc., than something scented. And I would recommend unscented Epsom salts. I use them myself all the time. They don't smell as good as the lavender scented ones, but again, I'm a little bit wary of the scent and what's in them. So I think unscented Epsom salts are really, at worst neutral, and at best, who knows, maybe they're doing a little something, but I'm not aware of any actual clinical studies showing that Epsom salts can decrease that vaginal pH. There may be. Okay. Can individuals measure the pH of their own vaginas? If so, how? I imagine it's not quite as easy as urinating on pH strips. Well, there are pH strips that you can get, the ones that they use at the OBGYN's office. Most of those are commercially available, and it's not urinating. You really do a smear of that. And there are a couple of ways that you can do it, but a way at home would be to use some sort of suction, like it's a dropper but reverse, where you suck a little bit to get the secretions and then you just drop it right onto the strip. So I think that's pretty easily done. And I don't think that there's any harm in doing that. If you want to know, it's the same thing that they would be doing at the OBGYN's office. As I said, in the old days, the doctors used to actually look at the smear, but that requires a microscope, and a microscopist, somebody who's familiar with looking at gram-negative rods, gram-positive, etc. So typically not doing that anymore, but I think it would be fine. It's sort of an interesting idea, right? And I love the idea of the citizen scientist. I think if you were going to act on it, you'd probably want to get some medical guidance, but I don't see a problem with checking it. Okay. Give recommendations for recurrent vaginal yeast infection, already eating a whole food plant-based diet, least processed possible, and not using soap, only water, using cotton underwear. Weirdly, it seems that sex favors it. By favors it, you mean causes it, right? Doesn't make it better. My boyfriend has sometimes symptoms too, even though it is really rare in men. Thank you very much. Yeah. So here's the thing, bacterial vaginosis symptoms and yeast infection symptoms can be very sort of problematic after sex. And that's probably because that the physical movement associated with sex kind of stirs up what's going, like a lot of these bacteria in the mucosal layer, and then with sex, with intercourse, they can, there's some stimulation of that layer. So it's not uncommon for people to first notice symptoms after sex. It doesn't mean the sex is causing it, but it is causing it to flare up. It's probably there underlying as a low-lying condition. And again, I think, if the way you approach the yeast infection is just to use an antifungal, like, whether you're using something like Monistat or using a prescription antifungal like fluconazole, if all you're doing is suppressing the yeast and you're not repopulating with healthy species, it's probably going to come back. So if I'm understanding you correctly, I mean, it sounds like you're doing great with the diet and great in terms of, not super sanitizing yourself with soap. The underwear is great. It may be that your vagina is chronically underpopulated with lactobacillus, because the same risk factors for bacterial vaginosis, they're very similar to the risk factors for yeast infection. And I don't know the history, but it may be, Eloise, that you had taken a lot of antibiotics in the past, or acid suppressing medication, proton pump inhibitors, etc. Not sure what the history might have been. So I think really focusing on repopulating the vaginal microbiome. And it sounds like your diet is already going really well, but again, adding in some fermented foods can be super helpful. And if you, if you are finding this is happening a lot after sex, I would maybe get in the habit of using the Florafam a little bit before and seeing if that helps. Okay, so Ashley, pretty sure I have chronic BV, cheesy discharge. Now, cheesy can be yeast or BV. BV is typically a thinner, whitish discharge, and yeast is typically cheesier, but there can be a little bit of overlap. You have a lactobacillus probiotic, you eat a relatively microbiome healthy diet. What are the next steps? You're afraid you'll get prescribed an antibiotic, so it's a bit wary to go to the doctor. And here's the thing, I want to be clear. I'm not saying never take an antibiotic. There are some circumstances where BV, your BV may be so overwhelming that you do need to do something to get rid of some of these polymicrobials. What you don't want to do is keep using a Metrogel situation where you keep lowering your population of lactobacillus. So I don't think there's any harm in going and finding out, have them measure your pH, have them do a culture. Ask for a culture, ask for, I know you're going to do the pH and look at the discharge, etc. But I'd really like to get a culture of what's going on in there so that I can better understand, what's going on in terms of the microbial mix, etc., and the path forward. So I would ask for that. And, again, I want to be clear. It's not that you should never, ever take antibiotics for this. It's going to really depend on a case-by-case situation, and particularly, if you're planning a pregnancy or if you've had PID before, other things, those things can sort of dictate a little bit how the doctor's going to go forward in terms of recommending something. But I just want you to be aware of these other things. So if you've done these things and you think you have something chronic, first of all, I think it's really important to distinguish, is this a yeast infection or is this BV? Because the treatment is very different. If you have a yeast infection and you start taking Metrogel, it's going to make the yeast infection worse. That's not a treatment for a yeast infection. You need an antifungal. So there is, even though the risk factors are similar, the treatment pathways are very divergent. So you want to know what that is. And the only way to really know is with a good culture. Okay. In the case of yeast infection, do I recommend over-the-counter treatments? Over-the-counter treatments are a great place to start, because even though antifungals like fluconazole, which is sold brand diflucan, can be very potent. Sometimes just one dose solves a problem. For people, these systemic antifungals that you're taking orally, they can be very harsh on the liver, and they have, a side effect profile that is less desirable than just something topical over the counter. So I think over the counter is a good place to start for a yeast infection. And remember, you can use a fluorofam if you're not sure if you have a yeast infection or BV, because that's just introducing more lactobacillus. The fork in the road comes with then going to the doctor and deciding, is it a prescription antifungal or is it a prescription antibiotic, right? That's where the big decision tree is. Okay, let's see, we got a few more questions over here. Does acyclovir disrupt the vaginal microbe? Does acyclovir disrupt vaginal microbes? Cheryl, that is such a great question. And I don't know the answer to that. It's certainly not, antivirals like acyclovir, which you would be taking for, for example, for an oral herpes outbreak, can be really effective. And I don't know the answer to that question. I would think not, but I honestly do not know the answer to that question. In terms of, from a bacterial point of view, I know they don't, because they're antivirals. So in terms of disrupting the vaginal flora, bacterial flora, the lactobacillus, they really should have no effect there because they're antivirals. They don't have bacterial effect. In terms of affecting it, if we think of the microbiome more broadly, in terms of not just bacteria, but also viruses, fungal organisms, etc., could acyclovir disrupt what's going on there in terms of the viruses that are present? It could. I'm not aware of the literature, but in terms of taking it and worrying about your lactobacillus being affected, I wouldn't worry about that. And I suspect that's what you're asking. All right. Fermented foods, which have the least salt. So this is really a brand by brand determination based on how it's prepared. Because, for all these fermented foods, they're typically using some sort of brine, salt and water. And I'll give you an example. There's a brand called Olive My Pickle. Olive, like, olives, olive oil, My Pickle. And I think they're based out of Florida. It's a husband and wife team, lovely company. I was introduced to them by a friend who's a sort of fellow microbiome researcher who was, I think, maybe on their board or involved with them somehow. And he told me about them. So I decided to buy some products from them. And the products were lovely and they came really well packaged, and they were way too salty for me personally. I don't eat a lot of salt. And I love that they were fermented small batch. They were, from a microbial point of view, much better, much more robust than anything that I could buy at the supermarket, but they were just salty for me. I recommended them to a patient who's sort of a ultra endurance guy, and he loved them. And they were very helpful for some problems he was having. He was having some problems with recurrent parasitic infestations that were sort of low grade, and they were very helpful for him. And he actually liked the salt because he was doing, 3-hour workouts and sweating a ton, and they were great. So it is a little bit trial and error. I get sauerkraut I get an apple cabbage one from the farmer's market here in DuPont Circle from this lovely Russian woman who sells it. It's not salty at all. I love it. I couldn't even tell you a brand because I just know it's the Russian lady from the DuPont Circle farmer's market, and she's not there every week. So I think you have to play around a little bit and see what it tastes like, read the salt content, etc. But in terms of the salt, it's not the vegetable, it's not the cabbage or the pickles or, the cucumber having it. It's a process of fermentation where they're adding the salt in that's producing the saltiness. I would say pickles are probably going to be saltier than sauerkraut, typically, but again, it depends on who's making it and how they're doing that. Can an E. coli infection of the urinary tract, in particular one that infected the kidneys, affect the vagina? I mentioned microbiome, immune tone of the pelvic region. Yes, they can. And that's why bacterial vaginosis is a risk factor, not just for sexually transmitted diseases vaginally, but it's a risk factor also for urinary tract infections, bladder infections, pelvic inflammatory disease, etc. And the same sort of vice versa. So if you had an E. coli infection of the urinary tract and one that was severe enough, what we call sort of an ascending urinary tract infection that went up and affected the kidneys, that can change the whole sort of microflora environment, and it could affect the vagina. So the other thing that I would think about is this sounds like a serious E. coli infection. I hope you made a full recovery. But with an infection like this, it's affecting the kidneys, you almost certainly would need an antibiotic to clear that. And the antibiotic that they gave you to treat this can also affect the vaginal microbiome. So it could be a little bit tricky to figure out whether it was the E. coli infection itself or the treatment for it, right? Because again, I think an E. coli bladder infection, people have used things like D-mannose to very successfully treat that. The D-mannose prevents the E. coli from adhering to the wall of the bladder. But once the kidneys are infected, that is a slightly different situation, and that would typically require an antibiotic, and the antibiotic again can affect what's going on vaginally. So a little bit difficult to sort that out. And Cheryl, again, I just want to circle back to you and make sure I was clear that the acyclovir shouldn't affect the lactobacillus, but it could affect other viruses that are in there vaginally. And when we talk about the microbiome, technically we're talking about all the microorganisms. So with microbiome, we're talking about bacteria, viruses, fungal organisms, protozoa, archaea, everything, right? And I sometimes talk about the virome to mean just the viruses, but that is sort of the more accurate definition. Okay, what else we have? I think that is it. So you know what? We are going to sign off a little bit early today with that. And we're just in the process of posting the July lineup. But I'll tell you what we're doing now is we're trying to be a little bit more thematic for the month. So our focus for July is going to be the effect of alcohol on cancer risk, on the gut microbiome, on the liver, etc. So that they'll all be a little bit different. The first one is going to be about alcohol and the risk of colon cancer. And I think the second one is about alcohol and dysbiosis, because there's so much conflicting information out there. You read articles that say alcohol, glass of red wine is great for the microbiome. And then other things that say, no, alcohol disrupts the microbiome. So we're going to be shedding some light on that and clearing things up. And again, also talking about something called NAFLD, non-alcoholic fatty liver disease, or sometimes just called fatty liver, which is confusing because alcohol can be a contributor, but they're distinguishing that from cirrhosis, a cirrhotic liver, which is just primarily the effects of alcohol, but somewhat paradoxically, alcohol can be a contributor to fatty liver too. So we're getting some other things in there, cancer, microbiome, liver, but we're going to focus a little bit on alcohol for July. And then in August, we're going to be really thinking about our antiviral strategies and how we can fine tune those. All right, well, it's been great spending some time with you guys.